Hi, I'm Dr. Jeffrey Riopelle, and this is part of a series of videos we produce for patients to help you understand our practice a bit better. I'd like to talk a little bit about fillers. Fillers are one of the mainstays of our treatment in our practice. Where would we use a filler? Well, fillers are used primarily for sinking. There are three parts of aging. There's superficial aging, which has to do with the red spots, brown spots, and fine lines. There's also sinking, which is where we use fillers, such as hollowness here, hollowness in the nasolabial folds, hollowness under the mouth, under the eyes, and so on. And then there's sagging. For sagging, we use other technologies such as thermage and thread lift. Well, let me talk a little bit about the fillers and what they do. Sometimes a patient may just have simply sinking and nothing else, and can actually look quite a few years older because the fat has decreased somewhat, and also because the bone, even the bone in the skull of the face, resorbs with time and therefore creates the sunken appearance. If we fill that sunken area in, we can actually greatly enhance one's appearance and make one look much younger. We can even do little things such as remolding noses to different positions or shapes and so on. So let's talk a little bit about the types of fillers that we use and where to use them. Restylane is the filler that's now been around for the longest period of time in the United States, as far as the fillers that we use in our practice. Restylane is hyaluronic acid, and it's a clear gel. The gel goes into the skin in various places and lasts about 6 to 9 months. So where would we use Restylane? Well, it's approved for use in the nasolabial folds, right in here, to revolumize there. But we use it in many other areas off-label. Physicians are allowed to use medications in places that we think they're appropriate, even if they aren't truly approved for use in that area. And this is the case with most fillers. They're used many, many places off-label by physicians. So Restylane is also used very nicely under the eyes for the hollows, around the eyes to sort of create a higher cheekbone. We use it sometimes in the hollow spots of the cheek to recreate the apple of the cheek, and also in the drool line area underneath the mouth. And it can even be used to sort of shift the lips up to more of a smiling position as opposed to the frowning position that we sometimes develop with age. And it's also very useful in the lips themselves. Another product is Juvederm. Juvederm was released more recently, and it's also hyaluronic acid. It's a clear gel. There's a softer product, part of Juvederm, called Juvederm Ultra, which is good for the lips, and a firmer product called Juvederm Ultra Plus, which is used in many of the same places we use the Restylane. So which one to use is somewhat of a preference for the physician using it, but I found that I can look at a patient and determine fairly well which is the best product to use in that particular patient. Another great filler is Radiesse, and we were on CBS TV a number of years ago doing Radiesse, and you're welcome to click on that part of the website if you'd like to see me actually putting Radiesse into a patient. But Radiesse is calcium hydroxyapatite. It's a white gel and actually occurs naturally in our bodies, although in the syringe it's made synthetically. And it can be used in many places cosmetically. It's a great volumizer. In other words, it's for creating volume where we've lost a lot of volume. So where we use it most is in the nasolabial folds and also in the cheeks. It really is nice for recreating the apple of the cheek and also for lifting the cheeks up. So very nice product. Then there are the collagen promoting agents. Radiesse that I just mentioned actually promotes collagen as well as filling. So when you apply it in the skin, the initial effect is a filling effect, but about a year later you'll have about a 25 to 30% of the volume of the radius that's actually grown in with natural collagen that the radius stimulated to grow. Sculptra is primarily a collagen stimulator, so we use it in the face if we want to stimulate one's own collagen to grow. So we use it primarily, again, in the nasolabial folds and in the cheeks to create volume, sometimes a little bit around the eyes and in the drool lines and underneath the lips. It's a very unique product because it doesn't really fill when you put it in. You get an initial slight filling that goes away in a couple days, but then the powder that's in the product, that's a liquid product that turns to powder, then stays around and stimulates your own collagen to grow, such that after 3 to 4 treatments you'll have a significant regrowth of collagen that can last up to 1 to 2 years. In biopsies done on people's skin a couple of years out, most people are still shown to have about 30% of the new collagen growth that grew as a result of the Sculptra. So it's a longer lasting treatment. In our practice, we don't like the permanent fillers. The permanent fillers, in my opinion, cause some great risk. First of all, if it didn't go in exactly perfectly, it's difficult to take it out. You can only get it out surgically. But more importantly, usually we get a very good cosmetic result putting in fillers, but the face changes with time. And as the face changes, it sort of remolds and remodels, and you can end up with a filler that you initially put here that now is in a different location, maybe lower down as the face has changed, and the patient is stuck with it. So we usually use the semi-permanent fillers such as Radiesse and the shorter acting fillers such as Juvederm and Restylane in our practice.